Hi, Dr. Ian, and topic for today is advice for dealing with TMJ problems or craniofacial pain. What I normally hear is and I'm going to be dealing with some general advice that I normally hear people being given. One is, so if it hurts, just stay away from it, right? Eat softer food. And this may help in the short term, get the inflammation going. However, in the long term, it has an effect on the muscle strength and leads to weaker muscles. And this in itself can cause imbalance of those muscles, and further down the line, further TMJ problems or jaw joint problems. The second is physical therapy, exercises, muscle massage, manipulation, anything that will help with inflammation of the muscles, and this can be sustained indefinitely for quite a long time as well, and be very effective. It does not, however, remove the core problem and the causes of the symptoms. Third one is mindfulness exercises, meditation, anything to decrease stress and therefore muscle overload. And these are part and parcel of a good jaw joint treatment regime. And the other option 4 is the application of some kind of a heat or cold compress. Now, heat normally increases the blood flow to the area, and that may not be the best option if inflammation is present. So we personally prefer the use of cold compressors to reduce inflammation and therefore then the pain to follow. Option 5 is some kind of a mouth guard or a protective plate on the teeth, and this is mostly applied to protect the teeth from damage. And these can be effective for jaw joints, but it's more of a coincidental effect where the downward displacement of the jaw allows for the healing of the jaw joint. So option 6, muscle relaxants and anti-inflammatory medication, and also the use of botulinum toxins or Botox may help short term to reduce the muscle activity. However, there's side effects to all these medications, and especially in the case of botulinum toxin or Botox, where the muscle activity is reduced to the extent that atrophy of the muscles actually occur, where the muscles literally wear away and the strength with that wears away as well. Now, the side effect of this is, for one, if you're not chewing properly, then you're having an effect on your diet. It's having an effect on your gut biome, on your digestive system. And the other effect of reduced muscle strength is something called Wolff's Law, where the muscle activity has an effect on the bone density and shape and size. So if you reduce the muscle activity, you reduce the bone density as well because of that, because the force is not being applied onto bone. 7 is myofunctional therapy, and this is a new discipline that's coming to the fore and is proving to be very effective. And what it involves is exercises to strengthen, but also to correct muscle movement. And these can be used in conjunction with other therapies to help with pain of the jaw. 8, in cases of loss of tooth structure, either tooth loss or tooth structure loss, and this can have an effect on the jaw because of the imbalance of forces. It may be necessary to replace that tooth structure or tooth itself through either dentures or fillings or crowns or implants to just rebalance the forces again. 9, lower jaw repositioning splints, as opposed to just the mouth guards. This is a more dedicated treatment option as just the mouth guards. And what it does, it displaces the lower jaw a little bit down or a little bit forward, and gives the jaw joint a little bit of time to heal and restore. And it's much more specific and dedicated to get that healing process going. And these splints normally have to stay in the mouth until healing takes place, and that's around 6 months. And then 10 is dental orthopedic or orthodontic treatment. And these are the most effective after recapturing the disc to try and get to the core problem in the first place. Any of these levels of treatment may be effective in dealing with the problem, depending on the case. And we believe that the threshold theory, in that there's a lot of contributing factors that has an effect on the pain, and to look at it holistically. And we may have to include any and all of these treatments to get to the core problem. With the threshold theory is that if any one of these factors that influence the jaw joint can be reduced, then the other factors will have to increase by some margin before the problem kicks in again. So that's the holistic view of it. Thank you for listening.